So I trained in minimal invasive cardiac surgery in the UK and then took a year off to train robotic cardiac surgery and minimal invasive in Belgium. Because my plan was always to come back to India because I studied in a government college. So there's always something we have to give back to the country. The robotic camera is about 25 times magnified than our normal vision. So we are able to see the tissues clearly and reach wherever we want to within the heart. Our bypass surgery patients go home third or fourth day. Similarly, valve surgeries. If there's only one blockage, they go home the next day with the help of instrumentation, robot, and all other technology that's available today. For many years, there was only one robotic system. Now, in the last year, there are about 25 systems, including one manufactured in India. So those robotic surgical systems have really brought the cost down.
Heart diseases is now affecting Indians much younger age.
We have taken the worst from the Western culture and lost the best of our own culture.
Welcome the New Indian Express viewers. As we know, India carries one of the highest burden of heart diseases, accounting for nearly 1 in 5 global cardiovascular deaths. Conditions such as coronary artery disease, valve stenosis, and regurgitations are being diagnosed not just in elderly people, but increasingly in the people in their 30s and 40s. Lifestyle changes, diabetes, and stress and delayed diagnosis have all contributed to this worried trend. To discuss this shift, we are joined by Dr. M M Yusuf with over 20 years of experience as a leading robotic and minimal invasive cardiac surgery in Apollo Hospital at Chennai. Welcome, Doctor.
Hello, good afternoon.
So, to get into the base, from a clinical and a surgical perspective, how do most heart problems actually begin inside the body long before they can find out the symptoms actually?
Hello, everyone. So, we can classify this into two types. One, congenital, which is patients are born with it and it develops over a period of time. The other is adult cardiac problems, which develops over their adult lifespan due to various factors. The common factors are diabetes has an influence, lifestyle has a major influence, which includes activities, smoking, food habits, and genetic also has an influence. So these factors play an important role in developing any cardiac problems, and this happens over the period of time. Of course, many of the manifestations are acute, which is like a sudden heart attack or sudden death or palpitations, but they develop over a period of time.
So, compared to 2 or 3 decades ago, heart diseases is now affecting Indians much younger age. How do you see this scenario?
Yeah, so that's very true. See, I trained in UK for many years. So when I moved back, I've noticed their coronary artery disease, especially, is a disease of the elderly. But here, the common age group that we treat, or more than 50%, are between 40 to 60 years. We are even seeing much younger patients now. So the problems are two. Basically, we can say we have taken the worst from the Western culture and lost the best of our own culture. So that's what has happened. The mix-up has messed up the whole system. So our lifestyle, which is very little exercise, stressful, and we all, look around and run around yearning our livelihood, in which we lose our life. That is something I have noticed drastically having moved back after 20 years. So that's something which plays a major role or influences a lot in the younger population getting these problems. But I think recently, over the last decade, the next generation or Gen Z or whatever they call it are becoming a bit more aware of their health status. So I think in the next generation, we may see a transition. But currently, as you said, it is true. I think we have to come out of it.
Okay. As you say, given these risks, what we practically lifestyle changes and preventive steps can people take today to protect their heart health, delay or avoid serious cardiac diseases, though are there any like lifestyle changes or the stresses being caused of these heart health problems?
That is a good question, because prevention is better than cure. Prevent the common risk factors. I'm just talking about adult cardiac problems because I am adult cardiac surgeon. So there are multiple congenital problems which we will keep away. The common adult cardiac problems have certain risk factors. The commonest in our country is coronary artery disease, which is unfortunately 50% of the world population is in India. So that's a big setback for us. So the common risk factors are diabetes, blood pressure, cholesterol, smoking, and family history. Family history we may not be able to influence much. Smoking is purely in our hands. The other three factors we can influence and control. So by lifestyle modification. So if we can prevent these factors, keep these risk factors under control, we can avoid the problems. Patients with family history, it is better to have health checks. So for anybody, for that matter, above the age of 40, it is always best to have periodic health checks. So above the age of 40, maybe once in 2 years, above the age of 50, once a year, it picks up problems at a much earlier phase, and we can prevent before anything sets in. So that's something we have to look at, and we can prevent problems before they arise.
But coming into your expertise, you have trained and worked in UK and Europe for nearly 2 or 3 decades before returning to India. Like, could you briefly explain that international experience shaped into your robotic and minimal invasive cardiac surgery?
It's interesting for me because when I was completing my training, UK, so I did about 20 years of my training. After my MBBS in Stanley Medical College in Chennai, I moved to the UK. I did my basic and higher surgical training there. When I was completing my higher surgical training in cardiothoracic surgery, that's when minimal invasive surgery was coming up. So robotic was not even in the arena then. It was just popping up. So I got interested in minimal invasive cardiac surgery because my plan was always to come back to India because I studied in a government college. So there's always something we have to give back to the country. So I wanted to bring something new. So I trained in minimal invasive cardiac surgery in the UK and then took a year off to train robotic cardiac surgery and minimal invasive in Belgium. So that was really influential in shaping me up later towards the current program, which is the robotic cardiac surgery program in Apollo Hospital, Chennai. We are the largest program in the country, and we started the program in the country. So that really helped me have that training and the expertise to start here. And I was fortunate, my trainer, mentor from Hals, Dr. Van Pratt, came and started our program there. So all this really helped us to channelize our program and do what we are today.
Okay. That's good. Like the valve stenosis and regurgitations are major common concern in India. From a surgeon's perspective, how has the understanding and management of these conditions have evolved in these last decades?
So all the heart surgery treatments have evolved a lot over the last 4 decades. In the last decade, robotic involvement or surgeons getting expertise in using the robot to perform surgery has really made a huge difference. So valve stenosis and valve regurgitation, the common valves that we deal with in the adult population are 2, both in the left side of the heart, mitral valve and aortic valve. So stenosis means blockage, and regurgitation is leak. So both can happen in both valves. So the robotic system was introduced and was dealing more with mitral valve problems before moving on to deal with coronary artery disease or now aortic valve as well. So these 2 valves are dealt with. So if it is stenosis, normally we have to replace the valve. But the actual difference in using the robot comes in when we are repairing the valve. So the mitral valve, for example, has a lot of attachments to the left chamber of the heart, the ventricle. So when these attachments are cut off and replaced, that has an impact on the whole heart performance. Whereas when we preserve that and repair the valve, the long-term outcome is much better. For this, the robot really helps, the robotic system. So the major advantage of the robotic system in minimal invasive heart surgery are two. One, the visualization. The robotic camera is about 25 times magnified than our normal vision. So we are able to see the tissues clearly and reach wherever we want to within the heart. The dexterity, the robotic arms, there are 4 instead of 2, and they move all 360 degrees. So these 2 parameters really help us to do the best repairs. So the advantage is really in performing the repairs, but overall it is advantageous because the cut is smaller and the recovery is quicker, which I'm sure we'll talk about as we go.
As I'll come again with the robotic surgery part. Before that, the patients hear about open heart surgery or a minimal invasive surgery or catheter-based procedures or even the robotics. How do you decide which patient benefit from which approach?
Good. So, yes, traditionally it was all open heart surgery. I think you're talking about valve surgeries for now. So, it was all performed with open heart surgery. The major drawback of open heart surgery is cutting the central chest bone. So, this bone is cut. Basically, we are creating a fracture. Any fracture takes 2 to 3 months to heal. So, that morbidity and the trauma is the biggest problem, and the fear as well for patient. In minimally invasive surgery, that is completely avoided. We used to make cuts on the sides of the chest, look through that with or without a camera, and perform surgeries. Then came robot, which made the cut smaller, and as I already mentioned, magnification better and 3D vision. So this is how the difference has happened. In my practice currently, for any standalone first time valve surgery, I don't open the chest. So basically all these primary valve surgeries can be done without opening the chest with the help of robot. So that is the current state of affairs. If it's a combined procedure, sometimes we have to do 2 valve surgeries or valve plus bypass surgeries, then we do a traditional way. It is not a bad option to have the traditional way, but it's always the best option to avoid cutting the chest bone and do it with least invasion. And you asked about catheter-based technology. That is even more minimal or even less invasive. It is the least invasive. So where like an angiogram, catheter is pushed in and the valve is deployed. But that's not for everybody. There are certain selection criteria, and currently, as per the European and American guidelines, which we follow worldwide, it is still for the non-surgical patients, which is patients who are not suitable for surgery, high-risk patients or moderate to high-risk patients, elderly patients.
So thank you for differentiating those procedures. But we need the real difference between the conventional open heart surgery and the minimal invasive valve surgery in terms of safety, durability, and long-term outcomes.
So, as I said, the major difference is avoiding cutting the bone. Safety, durability, long-term outcome is no big difference. The advantage of robotic or minimal invasive surgery, which can be assisted with robot or without, the major advantage is the morbidity. The fear, the trauma is significantly reduced. So there is less blood loss, very little pain, recovery is very quick. Patients stay in hospital for 3 to 4 days and get back to full normal activity within 2 to 3 weeks, as opposed to 3 to 4 months with open surgery. So that is the biggest difference. Blood loss is significantly less. So if as an effect of that, the overall complications like chest infection or in elderly people, wound infections from the leg or chest are all avoided. So that way, minimal invasive and robotic assisted surgeries are much superior. So there's been a recent review article which was published in Journal of American College of Cardiology, which is a major journal. They looked at all the patients performed in both ways, valve surgeries, bypass surgeries, traditional way and robotic assisted. And they showed in centers where they perform these robotic procedures routinely, like ours, the outcomes are better than open surgery. So that's where we are now.
Okay. So, like, thanks for clearing out this procedures. To again getting back into this robotic surgery, it looks like futuristic, but does it like specifically solve a problem in a cardiac surgery, or is it like an improvement in a future development or something?
Yeah. No, it is really not futuristic. It's already there.
Okay.
So not only cardiac, the robot has evolved and made a huge difference in all aspects of surgery. So mainly, as I said, by reducing trauma and enabling quick recovery with better precision. So that is very important. Precision is much better than in open surgery. So this has made a difference in all aspects, especially cardiac, because where the trauma is bigger cut. So there, actually, the robot, the system initially was introduced for cardiac surgery, but then it didn't take off for two reasons. One, surgeons were just then learning minimal invasive procedures, and the older system was different. Now we have the 5th generation system, which is much more advanced. So currently, in the last decade or just over a decade, there's been huge steps in cardiac surgery. Of all, India has made significant progress. When I started the program 6 years ago, we were the first ones. We have trained other surgeons across the country, and currently there are more than 30 centers across India performing robotic cardiac surgery as a routine. May not be as high as us, but still they are performing. So India has really taken a big step in moving forwards.
So, as in day-to-day cardiac surgical practice, which procedure, valve repair or valve replacement or CABG benefit the most minimal invasive or robotic techniques are beneficial?
So I think you're trying to get at which patients benefit most. In our country, as I said already, by coronary artery disease is rampant. So most of our patients, 80% of our procedures are coronary artery bypass graft surgery. So patients benefit the most from these procedures. The advantage of robotic procedure, apart from whatever I've told you before, for coronary artery bypass graft surgery is long-term as well. Not only short-term, but long-term also. Because in bypass surgery, generally, when we do open, we'll cut the chest and we'll also take vein from the leg, long cut in the leg. That is completely avoided in robotic assisted bypass surgery. So we don't make any cut in the legs, which has a big advantage in diabetic patients. There's no problem with infection, healing, and in slightly overweight patients. And in the long term, we use only arteries from within the chest wall. The biggest advantage of surgery over stenting or medical management is in using the arteries to bypass the blockage. In robotic surgery, all the bypasses are done only with arteries. That is the biggest long-term advantage. So most patients do not have problem for the rest of the legs. So of course we can do valve surgeries also, which we've already discussed.
So like what changes in training infrastructure and referral patterns are needed for advancement of cardiac surgery to reach more patients in India?
Oh, thank you. Because I think you are the people who can take to the other physicians and the public. That is very, very important. Training is important factor. So we are one of the leading centers across the world for training. I went to Belgium for training. So proper training is very, very important. After training, the surgeons have to be mentored as well, which is we call proctoring. Proctored until they are comfortable, which plays an important role in the best patient outcome. So that is something everybody has to take into account, all surgeons. And from the referral point of view, so it is, I always keep telling in every interview I go, it is best for any patient to consult their own family doctor first, rather than shopping around. It's not like anything else. So the family doctor would know who the best person is for any particular treatment, not necessarily heart, for anything for that matter. So, and they are the people who will know the patient better as well from childhood or for longer years. So it is best to go to the family doctor who can then do the necessary tests and refer to the appropriate surgeon or physician. This will avoid unnecessary shopping around, unnecessary testing, and landing up with trouble as well. So that's the best for the patients.
So I want to ask you personally, like in an operating room, before they were traditional open heart surgery, but now you are going with this robotic and minimal invasive. Has your experience has been evolved, or do you think anything new happening there?
Yeah, it is new. So I would like to explain how the operating theatre is.
Yeah.
Because a lot of the time patients come and ask, doctor, does the robo do the operation or do you do it? So what normally happens is the patient is lying on the operating table, but we sit in a console which is away from the patient.
Mm-hmm.
Currently it is connected by cables, but with internet connections,
Okay.
we already starting telesurgery. So where patients can be operated remotely as well.
Mm-hmm.
So there is a bedside assistant. It can be a surgeon or a physician assistant who will change the arms as required. So this is how the surgery is performed. So it becomes a completely different procedure to what we used to do.
Yeah.
Stand by the patient, feel.
Mm-hmm.
So all that is not there. That is a different experience.
Okay.
So and the dexterity is not there anymore.
Mm-hmm.
We learn to operate with hand and eye coordination. And it can be relayed to whoever is by the bedside, so that we can do more things with less people and better visualization.
So looking ahead of 10 years, do you see minimal invasive and robotic approaches becoming the standard care in India? And what needs to be changed to become that happen in India?
No, of course, it definitely is. There's no doubt about that.
Mm-hmm.
So currently, most specialties have already moved on to that. So cardiac is, as I said, probably the last to take it on. In the next 10 years, I think most cardiac surgeries, first-time heart surgeries, will be done with robotic. So there will always be few procedures which will be done with open sternotomy as conventional procedures, but more than 70-80% will be done with robotic assistance. And that will be enabled, as we already mentioned, by cost reduction and government's influence on that. And with more devices coming, I'm working with the Indian Institute of Science for some devices. So all these things put together will make it easier for many surgeons to adopt. That learning curve, which you asked me about earlier during this interview, will come down drastically. So that will really make a difference in more surgeons adopting and more patients taking it up when they get to know more and more about what is happening with better outcomes.
So I just want to ask your personal opinion. Based on your clinical experience, how do Indian-made cardiac valves compared with imported ones in terms of performance and patient's outcome?
So that's good, because there are few companies bringing out Indian valves now. So initially there was some skepticism about that, but now it's been more than 5 years and the outcome data is good. So what we have noticed in the Indian valves is, one, we have a good cost factor, advantage, and we are getting the same evidence, which medicine is basically evidence-based, which is collecting data and comparing the outcomes with standardized measures. Standardized is valves made in other countries, especially US. Now these Indian valves have very good data compared to these valves, internationally made valves. So we have to wait and see over the next few years as well. The early results and midterm results are very encouraging, and it's more and more surgeons like me also are adopting to use it. But with time, we hope to get better outcomes and even improve better, and more or less equally the same. I don't expect much difference between the valves made in India or elsewhere, because the technology is the same, and we have, in some places, we have even better technology at a lower cost. So that is actually helping us bring out, or helping the other companies, and with Make in India as a major factor currently being proposed by the government. All this is adding up to more and more takers coming in and manufacturing Indian valves.
Thank you, Dr. Yusuf, for sharing your valuable insights on how minimal invasive and robotic surgery are reshaping the future India's patient care. And these advancements are pointing towards a future where heart surgery is safer and more precise and focused on faster recovery and better outcomes. Thank you, Doctor.
Thank you.